Welcome back to Sugar High, guys. I'm PA David. I'm a board certified and licensed diabetes specialty PA in Southern California. And Sugar High is a channel where you can come to for relatable and reliable diabetes information that's always easy to understand. A while back, I made several videos covering lots of different medications, including the wildly popular type 2 diabetes medication Ozempic. The channel was still relatively new at the time, and I could not believe how well received that video was. Well, now it's been seen almost 1 million times, which makes me really happy because really all I wanted was to make a resource for you guys that you would find helpful. Well, in the fast-paced and always developing world of healthcare and medicine, any helpful resource will eventually need an update as information changes, new knowledge becomes available, and today I'm bringing you what's new with Ozempic. So let's get into it on Sugar High. All right, before we get rolling, could you please do me a favor? As you're watching this, if you find the information helpful, would you click that little like button? It looks like this. And subscribe to the channel. I know that every YouTuber says this, but it really does help this information to be seen by as many people as possible. My goal is to help as many people with diabetes as I can, and your interaction with this channel can be a big part of that. Oh, and if you've taken Ozempic before, I would love to hear all about your experiences in the comment section below. All right, the most important update that needs to be made since I last talked to you guys about Ozempic is that there is now a new dose available. When we talked before, the maximum dose of Ozempic was 1 milligram injected once a week. There were 2 different Ozempic pens available. This starter pen, which delivers either a 0.25 milligram starting dose or 0.5 milligrams, and that's the lowest effective treatment dose. That injector pen came with this red label, and if you wanted to go up to the 1 milligram dose, you would need a prescription for this separate pen with a green label that has the ability to dial all the way up to 1 milligram. Well, now there is a third member of the Ozempic family, and it has this sort of mustard yellow color to it. Each of these 2 milligram pens still has enough medication for 4 injections or a 1-month supply, and still comes packaged with the 4 needles that you'll need to inject it once per week. So why the higher dose? Well, several years ago, the makers of these GLP-1 medications started seeing evidence that higher doses offered even greater improvement to blood glucose control and weight reduction. In fact, before this higher dose of Ozempic was introduced, the medication Trulicity, which is in the same family of drugs as Ozempic, got approved for 3 and 4.5 milligram doses because of greater effectiveness and with similar safety profile to the previously available 0.75 and 1.5 milligram doses. So, not to be outdone, the makers of Ozempic conducted a clinical trial of their own that tested a 2 milligram weekly dose of Ozempic, and they found that, sure enough, it was even more effective than the 1 milligram dose. In that study, they found that the weekly dose of 1 milligrams brought about an average A1C reduction of around 1.9%, while the 2 milligram dose resulted in an average A1C reduction of 2.2%. Now, that average A1C reduction means the average of everyone taking it in the clinical trial. That doesn't mean that if you start with a certain A1C and then you use Ozempic 2 milligrams, that your A1C is going to go exactly 2.2 points lower, right? Some people in the study achieved a greater A1C reduction and some people saw a lesser reduction. But the average amongst all of them was 2.2% points. So perhaps a more meaningful way of evaluating the A1C reduction is to think about how many people on each dose actually reached the ADA goal of an A1C of less than 7%. Now, 7% might not be your goal. Your goal might be 6.5 or 6% or whatever you and your healthcare provider choose is right for you. But 7 is usually like the cutoff where we absolutely know that in most otherwise healthy adults, we don't want to stay at an A1C any higher than 7, right? So that's oftentimes set as the cutoff for a lot of these clinical trials about success. Of all those patients taking 1 milligram of Ozempic, about 57% of them reached an A1C goal of less than 7. But about 67% of people on the 2 milligram dose reached that same goal. So that's more. As far as weight reduction goes, there was a statistically significant increase in the amount of weight lost amongst patients taking the 2 milligram dose over those who were taking the 1 milligram. While different patients lost different amounts of weight, especially depending on where their starting weight was, the average of everybody taking the 1 milligram dose was about 13 pounds lost, and the average weight lost amongst the 2 milligram patients was about 15 pounds. Now that seems almost insignificant, but you have to keep in mind that this is just an average across all people in each group. So again, the amount of weight that you're likely to lose when taking Ozempic at any dose really kind of depends on how much weight you could afford to lose in the first place. So like the A1C, a more meaningful way to look at the weight reduction would to think about how many patients on each dose lost at least 5% of their starting body mass. So if we look at it from that standpoint, a little over 51% of people taking the 1 milligram dose lost at least 5% of their body mass, compared to 59% of people taking the 2 milligram dose. And that is a notable difference. So with that comes two sort of glaring questions that any reasonable critic would need to ask. Number one is, as you raise the dose, sure, you get more effectiveness, but would you also get more side effects? And secondly, is that difference between an average A1C reduction of 1.9% and 2.2% really significant enough to make it worth even bothering at all? Okay, honest questions. So let's start with the first question. It would be a reasonable suspicion to think that doubling the dose would double the side effects, right? Well, it turns out that that's not really what happens. In the same way that doubling the dose from 1 milligram to 2 milligrams doesn't double the effectiveness, it's just sort of like this incremental increase, it doesn't double the side effects either. There was a bit of an increase in nausea and vomiting and diarrhea frequency, but it was only a slight increase. If you look at the overall side effects in that clinical trial, of all the people participating in the study, about 52% of people taking the 1 milligram dose reported any sort of side effect at all. 57% of people taking the 2 milligram dose reported some sort of side effect. So you see that it's only a slight increase in any sort of side effect at all. Most of the side effects that were reported in both groups were mild or moderate, and there was no difference in the percentage of people who had to stop the medication because of those side effects. For most people, the nausea, vomiting, or other side effects were manageable and just sort of this temporary nuisance. There was no additional hypoglycemia between the two groups, and there were no additional deaths. So our second question is, does that higher dose result in an A1C reduction or a weight reduction that's significant enough to make it worth the trouble? Is there really that big of a difference between an average A1C reduction of 1.9% compared to a 2.2 drop? I mean, 1.9 versus 2.2 is only a difference of 0.3, right? So is that enough of an A1C reduction to really make it worth the trouble? Well, the answer to that question is yeah. When managing type 2 diabetes, every bit of A1C reduction matters. Any improvement, any steps that you can make toward getting you closer to that A1C goal reduces the chance of complications by a lot more than you might realize. Plus, that additional 0.3% reduction, again, which is just an average, is almost the same strength of A1C reduction that we get with some other very, very commonly taken diabetes medications. For years, one of the most commonly prescribed and commonly taken diabetes medications is a pill called Januvia. You've probably heard of it. The maximum dose of Januvia in clinical trials gave about a 0.7% A1C reduction. And when you take a placebo in clinical trials usually results in about 0.3% A1C reduction. And part of the reduction that we see in those numbers is that it's just sort of good for people to be involved in clinical trials because they get a lot more care and attention and counseling from their diabetes management team during those frequent visits that are dictated by the clinical trial. So that's why you see a reduction with placebo, even though theoretically placebo shouldn't do anything. So that means that the difference in A1C reduction between placebo and Januvia is only 0.4%. So if you're already injecting 1 milligram of Ozempic once a week, going to 2 milligrams gives you about as much additional help as adding a second medication. Not that we would use Ozempic and Januvia at the same time, they're not really used together, but I mean, hopefully you're able to see the point that I'm trying to make. Okay, so that's what's new with Ozempic dose options. There are some other updates that are worth talking about with Ozempic regarding reports about some additional possible benefits from Ozempic and also some additional possible harm. I was originally planning on including them at this point in the video, but as I started writing things out, I became a little worried that it's gonna end up being way too long if I try to cram it all in here. So what I think I'm gonna do is make a separate video talking about some recent news stories that you might have read about or seen on TV regarding the FDA updating Ozempic's warning label to include reports of a condition called ileus. I'll go deeper into what ileus is and what causes it, but it's sort of getting described as stomach paralysis or intestinal paralysis in most of those news stories. But what I will tell you right now is this. The possible side effect is, number one, really, really rare. And number two, it's nothing new. A major part about how GLP-1 medications work is to slow down how quickly the stomach empties. That process usually happens too quickly in patients with diabetes, so these medications are designed to try to bring back some of that normal function. And yes, sometimes they can go too far. Any good healthcare provider that understands how Ozempic and all medications in the GLP-1 family work knows that. And this is a possible, albeit rare, side effect that we should already as prescribers be aware of, and it's our responsibility to share that with our patients and decide whether or not Ozempic is appropriate based on that knowledge that we already had. I mean, there's no one drug that's right for everyone, and there are just some people who Ozempic shouldn't really be prescribed to. Also, there's some very wild and interesting details about the lawsuits that you've probably been hearing about that are going to be sort of fun to talk about. So I want to give all these details their due time, so keep an eye out for a dedicated video on this very topic. Lastly, a clinical trial testing the effect of Ozempic on patients with chronic kidney disease was recently ended early because it showed overwhelming positive benefit to the kidneys in diabetic patients who had previously existing chronic kidney disease when they take Ozempic. That's pretty exciting because while we've seen that benefit in medications in the SGLT2 inhibitor family like Jardiance and Farxiga, this is the first GLP-1 medication that's ever been shown to found to be possibly offering some kidney protection. That study is still wrapping up and they're analyzing the data, so it's going to be a little while. We don't know exactly when the results are going to be reported and certainly what the exact results are, but it was apparently positive enough to where they had to stop early. I will definitely be bringing more to you on that once that data is fully reported. All right, guys, thanks for tuning into this update on Ozempic. I hope that you found the information helpful and enjoyable. If you did, please make sure you click the like button, subscribe to the channel if you're new, and if you hit the bell, you'll be able to find out right away every time I post a new video. I'll see you guys again right here on Sugar High.